Hello everyone, I'm Dr. Aki and I'll be talking to you regarding FRCS preparation today. FRCS ophthalmology, as we all know, this is an internationally recognized qualification that ensures ophthalmologists are equipped with advanced knowledge and clinical skills. This qualification is held in high regard and is a testament to an ophthalmologist's knowledge, experience, and training. FRCS has got three parts: part 1, part 2, and part 3, and one need to clear all these three parts separately. Coming to part 1 is an easy exam. This is a written exam with multiple choice options. This can be written online at the comfort of your home with video monitoring. There will be 160 questions in 2 hours. Qualification is that you should have finished your MBBS, first year of 1 year of internship, and first year of clinical experience. So usually most of us write this during the first year of our after first year of our post graduation. There are certain exempting qualification to this FRCS Part 1, which include FSU Basic Science and Optics, FRCS Edinburgh Part A, MRCS Edinburgh Part 1, and FRC Opthal Part 1. So if you have cleared any of these exams, you don't have to write this one. Syllabus is basically on the basic science in ophthalmology. They can ask anything on the anatomy, embryology, physiology, pathology, and biochemistry related to ophthalmology. In their website, they have also mentioned you to read the AAO's basic and clinical science book also. Optics is included, but from the experience of many, the questions related to optics are rarely asked.
केरला वाले ऐसे ही बात करते हैं.
MBBS first year, the physiology books are also need to be read. Especially they can ask questions regarding renal physiology. And the book which I would recommend is John Ferris Basic Science book, which you have to read cover to cover. Coming to part 2, again, this is also a written exam, OSCE model. This also can be written at your own home with video monitoring. 180 questions are there in 2.5 hours. Eligibility is you should have completed your FRCS part 1. Again, MBBS, 1 year of internship with 5 years of clinical experience is required for you to write this exam. Exempting qualification is FICO Clinical Sciences. Syllabus is basically clinical ophthalmology. For this exam, you need to learn only Kansky. The latest edition of Kansky, you have to read it multiple times in and out. Also, they will be asking certain questions from Oxford Emergency Medicine book. They have also mentioned clinical medicine, but they actually ask only those diseases which have got some systemic manifestations as well as some ocular manifestations in common. But one of my friends have got questions regarding cardiac murmurs also. And in these exams also, they have got high weightage for ocular motility, strabismus, and neuro-ophthalmology. Coming to part 3, which is the most difficult exam, and this is a practical exam. And here there are two parts. First is a structured oral examination, which is followed by a 1 day gap. Then you have the next exam, which is the clinical patient examination. The dates usually will be announced 1 to 1.5 months prior, but you have to start your preparation minimum 6 months prior and keep the last 1 month only for revision. Eligibility is that you should have passed FRCS Part 2 or you should have cleared up to FACO Clinicals. If you have cleared up to FACO Clinical, that is a shortcut where you can directly write the Part 3 of FRCS. And here there are two modules, as I have said. First one is a structured oral examination, which is somewhat like an OSCE with viva. Here there are 3 stations. First is the lid, oculoplasty, and anterior segment. Second station is posterior segment. Third station is neurology, motility, and general medicine. The exams are usually conducted as a morning half and evening half. You can be allotted either of the halves, spanning over 2 hours. So here, in each station, there will be examiners. Each person is going to ask you questions for nearly 10 minutes. That means each station, you will be asked questions for nearly 20 minutes. Most of these are image-based questions. So that is why you have to know all the images of Kansky well. And some of the questions are something based on clinical scenario, wherein the examiner is going to narrate you a clinical scenario and then the questions follow. The main tip is here is you have to answer comprehensively. You have to start telling which are the history you are going to stress on, what are the signs you have to go and look for examination, and then what are the investigations and management. In this station you can be asked on detailed about the surgical steps also. I was asked regarding endopropian procedures, surgical steps, one by one. And in the viva station, the most difficult station is neuro-ophthalmology and ocular motility. I had taken my FRCS part 3 at Bangalore. There were a total of 80 candidates. More than half of them failed in the neuro-ophthalmology and ocular motility. The problem here is neuro-ophthalmology and ocular motility, they are going to ask you in depth. They'll be asking you regarding the anatomy of each and every muscles, their physiological action, their anatomical action, everything in depth, and they're going to confuse you a lot. That is why give more weightage to neuro-ophthalmology and ocular motility so that you can pass the viva. Then next is how to come up with a
Very
study.
good.
These exams are definitely challenging, so you need to spend plenty of time to prepare. Proposed is 6 months, but it is not possible. According to my experience, minimum of 2 months is required. You can take mock exams. There are a lot of websites which are offering mock exams for FRCS Part 3. And you need study partner or a study group for practical exams. There are a lot of study groups available in Telegram through which you can learn. For part 3, the second part is mainly on examining patients, for which you have to practice examination with your study partner. If you are into a subspecialty, like if you are into if you're a retina specialist, or if you are an oculoplasty specialist, you have to brush up all your general ophthalmology skills like concentration test, pupil examination, ocular motility, 90-day examination. And you can practice this either with the patients or with your staff or with your colleagues. Now the books to read. Basically, they're going to ask you mainly on Kansky, but there are certain books which you have to read beyond Kansky. So everybody will be recommending FRCS Cakewalk for the FRCS Part 3, but in my experience, this is not enough. You can also read the Fundamental OSCE Guide, which is by Tin Yin Wong. Similarly, there is Case Reviews in Ophthalmology by Friedman and Kaiser, which is very good when you are given case scenarios. And there is another recommendation, Oxford Handbook of Ophthalmology. You cannot read all of these, but try to cover maximum. Kenneth is something which everybody reads for FACO Part 3. Similarly, you can read this also for your FRCS exam. And this is another book which I actually came across this book very late. This is a very useful book, Practical Guide to Viva and OSCE in Examination. And the main the star highlight about this book is that in this book they have given paragraphs as to how to answer. So it will be written like, I'll be examining this, I'll be asking for this examination, I'll be seeking patient for this investigation, and this is the way the examiner also wants to hear. So this book is very useful in that manner. And coming to oculoplasty is, and especially neuro-ophthalmology and strabismus are the areas where most of us are weak. But there are going to be short questions from oculoplasty. Something regarding entropian or ectropian management, something regarding lag ophthalmos, surgical management, ptosis surgery with detailed steps. Since FRCS also covers surgical specialty, there will be a lot of questions regarding surgical steps and what are the surgeries you are going to recommend. This book Collins has got lot of flow charts on what are the different surgeries that you can do specifically. So this book is going to be very useful. You need to brush up this book before going for FRCS Part 3. At least the tables and flow charts you should be thorough with. And during in the motility session, again, you have a session on emergency medicine, and they are definitely going to ask you one or two questions regarding emergency medicine. This book on Oxford Handbook on Emergency Medicine is very useful because it has got algorithmic approach to TKA, MI, stroke, sudden collapse. And here, what the examiner expects is they want the answer to be like, I am going to do ABC, airway, breathing, circulation. Then I am going to look for this. That it has to be in a flow, and you have to finish the answer within 1 to 1.5 minutes. So what you can do for this, especially for this Viva sessions, is that you have to know your study material in and out, anticipate common questions and cases, and rehearse your responses and examination techniques. You have to rehearse this in a way that you will completely answer it comprehensively and crisply within 1 to 1.5 minutes. And maintain your composure during the question and answer session. You need to look confident, stay calm, actively listen. Another issue is with the accent of these foreign examiners. During my examination, I have got only two examiners who were from India, rest all were from abroad. So you'll not be able to pick up their accent so easily. So actively listen, pause, and then reflect and maintain an eye contact. Coming to part three, second session, which is a clinical examination. This has got 4 sessions, which includes anterior segment, posterior segment, neuro-ophthalmology, ocular motility again, and oculoplasty and lid disorders. So you will be going to all these stations in rotation. This is again conducted as a morning and evening half session spanning about 2 hours with short water breaks in between. Each of the station is around 12 minutes and each station will be having 2 to 3 examiners. In each station, you will be given 2 or 3 real patients and you will be asked to examine in front of the examiners. When you're examining, you are supposed to narrate your examination findings and also the diagnosis. This will be followed by 1 or 2 questions from the examiners. Total of 8 examiners are going to ask you questions. Maximum patients you can get is 12. If you have got 12 patients, that means you have passed. The key to success here is your confidence is examining quick and crisp answering, faster examination of the patient. You need to practice this, examining a ptosis patient within 2 minutes, examining a proptosis case within 2 to 3 minutes. Only if you examine the patient first and give your diagnosis, you are going to get the questions. If you are going to take a lot of time in examining the patient and then you are going to be very slow, and if you are going to if you give the answer in a broad way, you are going to get only one patient. That means you are going to fail. If you're getting only one patient, sure you're going to fail. Minimum of 2 patients you should get in each station. How to practice examination? By the time you are going to write FRCS part 3, you will be consultant somewhere. So that time you might have lost your systematic way of examining patients. So you have to watch the videos again. So there is a site which is a website which is called the Chua website, in which there are videos of clinical examination, and this book is also very useful for the examination techniques. So this is screenshots taken from the Chua website where they have given videos of how to do basic ocular movements, pupil examination, third nerve palsy, everything. Similarly, this is a screenshot of a website which is there in the of a site which is there in YouTube also. Here they have given all the FRCS ophthalmology clinical examination techniques. You all might have heard about Muthuswami classes when it is coming to FRCS. It does have a pivotal role in case of FRCS Part 3 because here you can get the past candidate experiences and questions, and all the books to read on each topic is also there in their Telegram group. They will also be sharing specific journals on articles which have to be read outside from these books. Classes will be conducted on a regular basis, especially on the high yield topics by candidates who have already cleared FRCS. So once you have enrolled for this exam, you just have to send a mail to this mail ID which I have given here, and then he will enroll you into that Telegram group. So the main reason why most of the candidates fail in FRCS Part 3 exam is that you are not able to answer crisply, or you are not able to examine the patient swiftly, time bound. So you have to keep on practicing with the time limit. Then only you can pass this exam. Otherwise, this is just easy, especially for those who have cleared DNB. This is going to be very easy. So my final tips and takeaways are: make a timetable, prepare properly, Refine your answering style. Practice answering questions time bound. During your practicals, aim for getting maximum patients, so try to examine them fast. Practice with real patients, or if you're not able to practice with patients, you can practice with your colleagues or with your staffs. Dress neatly, you can wear your apron, speak and look confident, be polite while answering, and be very crisp while answering. Thank you. If you've got any doubts, you can just put a mail in my mail ID. Thank you.
Okay, thank you, Raki. That was really nice. So, you feel that what is the best time to start? Is it like we should finish the first two exams during residency, or you should do it in the fellowship or maybe after residency?
First two parts are comparatively easy. For a person who has just finished her PG just after the exam, PG final year exam, if you have got, you might be starting to practice somewhere. During that period itself, you can try to write that second one. And first one, you can actually write it soon after your first year. That will be the easy way. Otherwise, you might have already forgotten the anatomy, physiology, and everything. So it will be difficult.
Okay. So if anyone has any other doubts, please you can use the mic and ask Dr. Raki. She's still there with us. I think we have few in the chat. So she's asked, what is the ideal time to appear for FRCS Part 1? I think that you have already answered. So Akash is asking, can we practice outside after FRCS? So do you have any experience with this? What is your view?
Now, actually, we can practice in some NHS based small setups like our PHCs are there. So there you can practice, but into the main substream you cannot.
And we'll require the GMC registration.
Registration is required, and this one is not enough for you getting to practice in the subspecialty also.
Yeah. So this is very important point because there is a lot of misconception that to go to UK or if you want to travel practice abroad that you need FRCS. I feel in few of the Middle Eastern countries FRCS is recognized that it just helps you, but that is not a like a criteria to practice
I
anywhere.
have seen here that most of the people write FRCS especially to get job opportunity in the Middle East. And if you are a FRCS holder, your salary is also very high compared to the others who doesn't have it.
Yeah. So if you're targeting Middle East, then definitely in India, I don't think you will get a higher package if you are FRCS pass, and it may not matter also to the employer that it won't be given weightage even if it is between two candidates. If someone is FRCS pass, obviously unless if it's an institute, maybe yes, but not in a corporate setup, right?
Right.
So I think people can use mic and yeah. Okay, so any age limit do you know about for FRCS exam, Rakhi?
No, I had a candidate who took exam with me. He was 70 years old and he
You're
cleared
sure,
it.
you're
And
sure
he cleared it.
he wasn't the examiner?
We all thought he was the examiner because he was having completely gray beard and
Are you
he was
talking
like,
about me?
no, 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 no.
Okay.
And we all thought he's the examiner, but he actually read the Kansky again, everything again, and he came here. But he cleared it.
Okay. Okay. That is nice. So there is no age limit. So if it's not for your job, if you are doing it just for the passion and just to have to prove yourself to know more, then you can carry on anytime. So time is not yeah, it's not going to run short. And but yes, the best shot would be in your residency because you're anyways studying and it will boost your this. Then any age. So this again, I think you can just repeat maybe for those who missed. After passing ICO, do we have to give all steps of FRCS?
FIC, if you have cleared clinical, you can directly write part 6, part 3. This is an easy step actually.
Okay. And yes, Dr. Chinmay is asking, after passing FCPS, can we apply for FRCS? Now, I don't know what is FCPS.
Right. And that was not there in the list of exempting
Yeah.
exams.
Chinmay, can you just use the mic if you're there still?
Sir, I'm a different Chinmay, but I also had a question.
Okay, no problem. Go ahead.
I wanted to know from a private practitioner's perspective, how important is this exam? And are in an urban setting, are the newer generations or the younger patients, are they actually seeking out for doctors who are having these credentials?
I don't think so because most of the patients are not much aware of this. This is the importance of this exam and its weightage is known only among the ophthalmology people only. But one thing I have noticed after passing FRCS is that my way of examining patients have changed. It is actually very useful when you are doing your practice. Otherwise, my salary didn't go up, nothing much, but I just wrote it.
No, no, no. I think Dr. Raki is being humble. Okay, so yes, I think that's a very important point. In India, you cannot weight in terms of quantity. It is not going to make difference to your patients or this because you have to remember even most of the people will not know a difference between what whether it's FCPS you have written or it is FICO, FRCS, what you have written. So it really doesn't make a difference. But yes, the number of post-nominals you have, the patient will definitely feel that you are maybe a more experienced or a better doctor. So that definitely adds, but nothing in particular about FRCS as such. And so, as Dr. Raki said, it is something which should come from inside that you want to become better. And if you take exam, then you prepare more, and that's what makes a difference. So the only motivation if you're not planning to go abroad is that you want to read more, and if you pay the hefty fees, then that is the number one motivation to read
That
at.
is the number one motivation, sir. I have paid somewhere around 1.75 lakhs for the part 3. So it was like a pressure inside me that I have to pass.
So we know only rich doctors give these exams. So again, so that is. So yes, that is very important point. If you want to give this exam, then pay the fees. Then only you will be able to study. Don't wait that I will finish preparation and then I will apply for the exam. If you think you want to go for the exam, then pay the fees today, and then definitely that is the number one motivation to start studying. Otherwise, it will be very difficult. You will keep on postponing. What do you think, Raki?
Same. I have got few of my friends doing the same. Like they were keeping on postponing it. Finally, they just paid the fees and then they really started studying. But she was keeping on preparing for the past 6 months, but it was not full fledged. Only once after paying the fees, she started preparing seriously.
So okay, FCPS is fellowship from College of Physicians and Surgeons, Mumbai. So yes, this is not exempted for FRCS. This degree is not recognized anywhere outside Mumbai or Maharashtra. As the next question is, as we can give FRCS final after passing FICO, can we give ICO 2 directly after passing FRCS 1?
I think that is not there. I'm not very sure about it, but I have not heard it the other way around. Usually it is after FIC or clinical, you can give FRCS 3.
No, there are some crazy people who do that. Okay, and that I had done that, so I know. So it's because FRCS part one, those who don't have much knowledge, so the optics are very less in FRCS part one in compared to ICO. ICO optics is a separate paper. So those who don't have much knowledge, they go for FRCS part 1 and then they go for ICO part 2. So it was eligible when I was there. And but you should always check with the site because these rules they keep on changing.
Okay.
And
Can you just guide us? There is something which is known as FRC Opthel and FRCS. What is the difference and which one should be preferred?
I think FRC Opthal is a little bit superior to FRCS, and that gives you a chance to practice abroad also. I am not very sure of it, but it is that exam is really difficult, much more difficult than all these exams.
yeah, so FRC Opt is an exam of UK. So it is only recognized in UK, and for this, I think you have 5 to 6 parts, and you have to clear refraction practical as well. There is a practical for retinoscopy, and now they have centers even in India for retinoscopy. But earlier you had to travel abroad, and these exams, I think you cannot club like taking part 1 and part 2 together. You have to take it stepwise. And these exams are only for those who are sure that they want to practice in UK, because these will not add on to your resume, or they may not be accepted even in Middle East or any other place. But if you want to practice in UK, then FRC off is a good exam to take. And there are now centers in Mumbai also. I think New Delhi, there's one center. And if we had one session where we had covered FRC opt, so if you want, you can watch that link. And but that is different than FRCS. It is a proper exam, and it is, I think, 4 to 5 parts.
Thank you. And in case we have already cleared up to MRCS, and after that, can we switch to FRC Opthel, or that we have to start from the scratch?
No, MRCS and FRC opt, they will not exempt you. You have to give FRC opt. There, I don't see there is any exemption. MRCS is again just a tagline that I think you can get even after you clear your FICO part 3. So I think, do you think, Dr. Raki, is it still on? Can we apply for MRC opt?
No, that route has been, it's not there now.
Okay, yes, because I think the pattern of FICO part 3 has changed. So those who have passed in like maybe 3 4 years back are still eligible. But now what the FICO part 3, they are not giving for MRC.
And after the clearing this MRCS, after clearing this MRCS, directly we are supposed to apply the FRCS part 3. How frequent is notification of the exam, and how can we come to know, okay, when is the next notification of the exam?
So this part is really difficult, like coming to know that when they have called for the registration of the exam. So for this, you have to join these groups. So I had joined some of these Telegram groups, and in this, some of the people who are applying will put on post like it's open now. Only through that, or if you have few friends who keep on checking their web page frequently, then only you'll come to know. Otherwise, by the time you know and you're going to apply, the slots might have been already filled.
Thank you. And by any chance, this FRCS part 3 happens in India, or is it like only in abroad?
Now we have centers in India. It happens in Delhi, Mumbai, and in Bangalore. Bangalore is the center with the highest pass rate, and that's why everybody waits to get a slot there.
So that is the take-home message for today, how to prepare. And for these groups, I think we have Dr. Abdul Shakur from Pakistan who's there with us, and he has also a very nice group. So if anyone is interested, you can join his group also. And he keeps on posting informations and recent advances, so that can motivate you to study more.
Can we request you, if you have available those links, to join in to put this our world group or any other group where you can?
Yes, yes,
I
yes.
can share those links.
Yeah.
Thank you. Thanks.
And do we have any more questions if we have not taken as we have covered? Okay, so what should be the total amount? How should we start preparing for
First
the
part is somewhere around 40,000. Second part will cost you around 60 to 70,000 now. And the third part, total it was 2 lakhs for me, including the stay and everything.
okay. So Dr. Raki will also share her itinerary, how to get it under 2 lakhs. So that is nice.
And another tip I would like to give you is you can carry your own instruments. Most of them, like most of the people, don't carry their own 90D, 20D, and their own indirect ophthalmoscope. But I had carried my own indirect ophthalmoscope and I was allowed to use it. Many of them find it difficult to focus with the slit lamps that they provide. Some of the slit lamps are very old fashioned, it's not the new ones which are there in the market. And so the people struggle with focusing, and that's how they lose their time. It is like you need to minimum you have to examine 2 patients within that time. So if you're going to struggle a lot of time trying to focus on what is there in the cornea, then you are going to lose time. So slit lamp you cannot take, but the rest, like your own clean 90D, if you're going to use the 90D which has been used by a lot of people, so you can take your own instrument to use it.
Okay, so next question is which one should we which one is more recognized, FICO or FRCO, FRCS?
Obviously, FRCS.
So ICO is just because you are doing residency and you have some extra pocket money, so you just get one more degree, and you can apply for the ICO fellowships, but it is not a degree which gives you any weightage even any place. So next question is, which one should
Can,
be FICO or FRCS? Okay, this is already done. What are the books to refer for clearing part 1? I think Dr. Raki has already covered that. Maybe you can just brief give some for part 1 FRCS.
Part 1 FRCS, everybody reads mainly John Ferris basic science book. That is more than enough. And optics, as I said, rarely asked. Don't waste your time much on that. Then few questions, very few questions are there from renal physiology, the first year physiology. That if you don't read also, it will be fine. But still, some questions are asked from the first year physiology. Mainly John Ferris, cover to cover.
now, if I have cleared that MRCS, that is with Edinburgh, can I switch to FRCS for the Edinburgh or Glasgow or London? And does it make any difference which one is like to be preferred?
If you have cleared MRCS Edinburgh, I think you can directly write FRCS Part 2. So there is an exemption for that. And regarding the other thing, which is more weightage, I think sir might be a good person to answer.
I don't see. I think no, I don't know. That's a tough question. We'll try to find out. Maybe Dr. Shakur would like to take that if he's there.
Yes, hello everybody. Can you hear me properly?
Yes, Dr. Shakur, please.
Okay, one simple sentence. ICO previously used to be very easy because of the past papers, and now they are coming up to the mark with Royal Colleges, all of them. So they have made their exam very difficult, even more difficult than any of the Royal Colleges there. If you ask my opinion, I will say first of all, go for the London FRCS and the FRCO. And if you cannot prepare so much, you are busy with your jobs, then please opt for the FRCS Glasgow. That's the better than all of them. Thank you.
Okay. So that is a good input. Thank you, Dr. Shakur. And what is the difference between FRCS Edinburgh and FRCS Glasgow? So it's just difference in the maybe the university and the location and the type of exam.
Yes, Edinburgh, they ask reflection, and Glasgow people, they ask the emergency medicine too much.
Okay, okay. So that is good inputs we have got.
Also, I had this clinical diploma from Edinburgh. So Edinburgh people, they will make you work on a clinical scenario, the bigger clinical scenario. Sometimes 6, 7 questions come on that. But it was of that Master in Community Ophthalmology from Edinburgh. The FRCS Edinburgh, I think they give the straightforward question.
Okay. So will finishing FICO and FRCS increase the chance of job recruitment in UAE? Okay, and ma'am, if I finish FICO, can I appear for FRCS Glasgow Part 3 directly?
Yes, I have said you can directly appear for that.
And what about UAE? Any idea?
UAE, as I said, sir, most of my friends here are actually preparing for FRCS only for that job opportunity and the package.
Yeah, that is,
Uh,
yeah, if you talk to someone who is from Kerala, then their next destination is
UAE.
UAE. Yes, Dr. Shakur.
uh, yeah, I wanna make some input. Some of the countries like Iraq and Egypt, they have some value with the FICO, some value
Okay.
with their master degree program. Otherwise, as for clinical orientation and the job is concerned, FRCS is preferred everywhere. And I want to thank Dr. Raki. Very good presentation indeed. A lot to learn for me as well.
Thank you. Thank you.
Okay, I think if anyone has any other doubt, please you can take the mic because Dr. Raki has covered most of it. And if we are if no more doubts, then we can call it a day and let Dr. Raki also relax. I think yeah, Telegram and WhatsApp group links I will share in the groups if I get more, and Dr. Shakur's this also I will share so you can get direct in touch with Dr. Shakur, and if you want you can get in the age is not a bar. I think Dr. Raki has given a very nice example that 70-year-old gentleman clearing. So I think more you age, the more chances of clearing. Is it like that?
I think it will be difficult if you are crossing the age because you need to examine very fast. You need to be very like running around. All these things are there. So there was a lady with us who was having difficulty with walking. So she was finding it difficult to move from one station to another station and all. So that things physical is also there, and your memory is another thing. I think it's better to clear it early.
Yes, yes. The earlier the better. Otherwise, you have to train in the gym also. That's what Dr. Raki is suggesting. And so I think it was really nice. You put forward how to go about in each step, and these small inputs which you have given will be really great. So take home messages start early and pay the fees and go for the exam if you are planning for Middle East, or if you want to get one more degree, or if you want to be a better clinician. If you have any other motivation, then this exam is not for you, and it definitely will not increase your pay, at least in India. So we'll call it a day, and thanks a lot, Dr. Raki. Dr. Raki is really busy. It's been really tough to catch her, but we'll definitely catch her with any other topic soon, and which she will oblige. Okay.
Yes, sure. Thank you.
Yeah,
Thank you.
I'll share the contact details of Dr. Raki, so you can get in touch with her if you want. Okay. Thank you. Thanks a lot, Dr. Raki.
Okay, sir. Thank you. Good night, everyone.
Thanks. Good night.